Hello, welcome to Chairside Live. I'm Megan Strong.
And I'm Will Schmidt, registered dental assistant here at Glidewell Dental.
Thank you so much for joining us today. It's a good one. You're going to be glad you did. Dr. Manalili, she's continuing her series where she's featuring the impression process for taking an impression of a Bruxer full arch implant prosthesis. But in this episode, she's fabricating the Implant Verification Jig.
That's right, and she's ensuring a passive fit of the eventual full arch Bruxer prosthesis. So she's making sure that what you see exactly in the mouth is translated to the master cast at the lab.
Perfect. Well, Dr. Manalili, let's see your jig.
Thank you, guys. Just like Megan and Will said, in today's episode, I will be demonstrating the use of an implant verification jig. It is a vital step when restoring implants, as we know implants aren't teeth. They are rigidly fixated in place. The more accurately you can capture the implant positions, the less stress you'll place on both the implants themselves and the prosthetic on top. Providing the lab with a verified impression will allow them to create a beautiful, passively fitting prosthesis. So let's get started and I'll demonstrate just how to use an IVJ. The first thing we are going to do is remove the healing abutments and insert the multi-unit abutments, or MUAs, that were selected by the lab. These MUAs help idealize the implant angulation and raise the restorative platform to allow for a healthier and more predictable restorative design. Once the MUAs are in place, we begin to seat the implant verification segments. These segments are made of temporary cylinders luted together with a rigid material in the laboratory. As you can see, each segment will come numbered, making it very straightforward when placing each piece intraorally. There are two things we want to check before moving on. The first is verifying that the segments do not touch, as this could prevent them from seating passively. The second will be making sure each segment is fully seated. If you do not have MUAs in place, it is important to have radiographic confirmation. In this situation, however, the MUAs have raised the restorative platform so we can visually verify that our implant verification segments are fully seated and the radiographs are not necessary. Now we are ready to connect the individual segments. To do this, you want to use a rigid material. You can use a Duralay acrylic, triad, or a flowable composite. As you can see, I like to use flowable composite because it is odorless, easy to apply, and is fast setting. Make sure that whichever material you choose in your office, that you fully connect the segments together on all sides. One of the advantages to having the lab fabricate the IVJ is that I know the bulk of the material has already been added, decreasing my chair time. Additionally, it gives me the reassurance that there will be minimal distortion due to bulk material shrinkage that can otherwise easily happen when you're using large amounts of composite resin, UDMA, or PMMA. Now that the segments are connected, we can try our custom impression tray in. You want to make sure that you can easily and repeatably seat the tray without the IVJ catching on the holes. For easy identification during the impression, I like to make sure the top of the lab screws are either sticking out or are flush with the custom tray. If you are having difficulty, you can connect the holes, creating one large trough. This will make it easier to seat the tray. I like to add wax over the holes or trough that I created. This will help keep the impression material in place, allowing for easy identification of the top of your IVJ screws. The tray is painted with PVS adhesive and set to dry. We will be using a combination of both a light body and heavy body capture PVS impression material. The lighter viscosity material is flowed on the soft tissue underneath the IVJ to ensure we capture the detail of our soft tissue contours in our master cast. At the same time, my assistant fills the tray with a heavy body PVS material. Once seated, you can use the end of the mirror to help identify the tops of the screws before the impression material fully sets. After the PVS is set up, it is time to unscrew the jig. I like to gently pull up on each lab screw to ensure that they are fully disengaged before attempting to remove the impression. Now you can remove the impression and send this back to the lab. With that, thank you for joining me today on another episode of Chairside Live. Next, we will continue this case and we'll walk through perfecting your wax rim and bite registration.
Thank you so much, Dr. Manalili.
And be sure to tune into the next episode where Dr. Manalili is going to go through the steps for the wax rims and the bite registration.
It's going to be a good one.
I think so.
But today, this good one's all wrapped up. So on behalf of everyone here at Glidewell Dental, thank you so much for watching.
And we'll meet you right back here next time.